Great. Hi, everyone. I just want to welcome you. My name is Ashley Klein Jimenez. I am with Valor US. I'm having lots of technical problems, so I apologize in advance. I am only called in right now. So I am not even in the Zoom room, can't see anyone. So I will be relying heavily on my Valor colleagues, but just wanted to welcome you. We'd love to have you introduce yourself in the text chat and just let us know where you're joining from. Yeah, Priscilla, if folks are doing that and you want to let me know who's joining, that would be great.
Hi, everyone. This is Priscilla from Valor. Right now, we don't have anything in the chat, but we did want to let you know before we begin today, one of our interpreters is going to be giving instructions on selecting English or Spanish language settings. Yes, please. Thank you. Thank you so much.
Thank you. Great. So I am going to do my best, not being in the actual Zoom room, to get us started. But once again, I just want to invite you all to this is our web conference number 2 in a series of web conferences. And this is titled "One Size Does Not Fit All: Strategies to Center Survivors with Intellectual and Developmental Disabilities." This training was really developed for an audience of disability service providers. That said, I do expect that a lot of our Rape Crisis Center colleagues will be in attendance today, and we welcome you. We hope you will have some takeaways, and we also hope that you join us in the fall, because in the fall, we'll be exploring how Rape Crisis Centers and sexual assault advocates can partner with disability service providers to support survivors with intellectual and developmental disabilities. So I just wanted to say that. And I think with that, I'll move ahead to just briefly share about additional aspects of Zoom, which is interesting since I'm not able to use any of them myself right now. But we will be asking you a series of polling questions and text chat questions. And so we'd love to hear from you all. This is really meant to be more of a conversation with you. So please, if you have questions, feel free to put those in the text chat. If you have any trouble with technology, I have some of my Valor colleagues in the Zoom room that can assist you with that. If you are dialing in, if you're getting your audio that way, then you can use your phone to do that. And then we will be sending slides and the recording of this web conference following it. So it is being recorded and we do have the slides available. And yeah, we can move on, which I think is going to be our first audience poll. So if one of my Valor colleagues can launch that poll, we'd love to know what kind of organization you're joining us from. And I believe that you will have a list of options. And so I'm going to ask Priscilla if you would maybe share what is coming up in the poll.
Sure. So it looks like dual agency is coming up, Rape Crisis Center, and we have one disability service provider. Yeah, so far still dual agency rape crisis centers.
Great. Well, we're happy to have you all here. You know, this web conference, and we can move on to the next slide, is really part of our summer workshop series for community partners. We're calling this our collective power to eradicate sexual violence. And, you know, like I said a few minutes ago, this series is really for community partners who are working with sexual assault survivors among their clients that they're working with. And so we've really grounded these web conferences in our community blueprint for community partnerships, which we'll be sharing about a little bit later on. But essentially, that is a roadmap to create partnerships and collaborations between rape crisis centers and rape crisis and domestic violence agencies and organizations and sectors allied with the anti-sexual violence movement. So, you know, we really hope that you'll share this information with your networks and partner organizations. You can see that in just a couple of days, we'll be focusing on substance use, abuse, and dependency and sexual violence. Later on in the month, we'll be looking at immigrant sexual assault survivors. We'll also be turning our attention in July to faith-based communities, campus communities, and then how we can create partnerships with labor to prevent workplace sexual violence. So again, these web conferences have really been designed with those sectors in mind. In the fall, we'll be doing a series specifically for rape crisis centers to be able to partner with each of these communities and sectors. And I think we'll go to the next slide. I did just want to let you all know that Valor is hosting the 2021 National Sexual Assault Conference in August. It will be virtual again this year. And our theme is advancing equity, ending sexual violence. There's a website that you can get all of the most up-to-date information on, and if one of my colleagues would post that in the chat, I'd really appreciate that. We're hoping to open registration in the next week or so, so we'd love to have you there. And then if we'll go to the next slide, we'd love to just have a little bit more formalized introductions from you all. So we'd love to know your name, your pronouns, and where you're joining from. Again, my name is Ashley. My pronouns are she and her, and I'm joining you from Northern California today. I live rurally, and that could explain some of my internet problems this morning, but we'd love to also know where you're joining from. And Priscilla, if anyone's responding to that, feel free to shout that out. I'd love to know who's here with us.
Yeah, we have a couple different folks who've introduced themselves. We have Katie, a program specialist from Mariposa, California. She's from Mountain Crisis Services. We have Meredith Bartley, a communication coordinator with the Autistic Self-Advocacy Network, joining from DC. We have Shelby, who we're going to introduce next. She's also from Valor. Linda, community outreach in Oakland. And then Melinda, PhD candidate, who's studying rape victim advocacy for culturally specific communities in the Women, Gender, and Sexuality Studies Department at University of Kansas. Also a volunteer at the Rape Crisis Center coming from Birmingham, Alabama. Audrey from New York, a college specialist. Jesus, bilingual prevention specialist from Santa Rosa. Nicole from Long Beach, California, which is where I'm also at, prevention education specialist for Waymakers in Orange County. And then we also have Marcella. Marcella is also from Valor.
Excellent. Thank you, Priscilla, and welcome to you all. It's so great to have you in this discussion and web conference today. I'm sorry that I'm not in the room with you, but it's so great to have you here. Priscilla, if you just want to introduce yourself, I don't know if you did before I got on, but I'll hand it to you to do that before we introduce Shelby.
Hi, everyone. I'm Priscilla Clausen. I'm project coordinator at Valor. My pronouns are she, her, hers, and I'm really excited to be joining you all today. So thank you so much, and I hope you bear with us while we figure out our tech issues. And also, I have a little bit of a cold today, so I may be muting myself to cough every once in a while. So we appreciate your patience. And then I'll turn it over to Shelby if you want to introduce yourself.
Sure. Hi, good morning, everyone. My name is Shelby Phillips. My pronouns are she, her, and I am the project and communications coordinator with Valor. And I will be here on today's session to provide some extra tech support to you all. So if things come up during the session with your audio or anything else, feel free to send me a private chat and I'll be happy to help you troubleshoot.
Thanks, Shelby. Thanks, Priscilla. All right, so I think we're going to ask another audience poll. We have quite a few of those. I hope you all are ready to click on the computer. So our next poll is, we're just really interested in knowing how familiar you are with our work at Valor, formerly known as CalCASA. I think a lot of you probably are familiar with our work because you are coming from rape crisis centers or dual agencies in California, but we'd love to get a better sense of that. And Priscilla, feel free to let me know what you're seeing.
So it looks like most folks are very familiar. We have a couple slightly familiar and have heard of Valor, but don't know much about it. So far, no one's clueless, no one's not familiar. So that's good.
You've come here somehow, so you're at least like familiar. That's great. So, well, I'll just share briefly. We are really leading a national movement to end sexual violence in partnership with survivors and other anti-oppression movements. And we do this through a really multifaceted approach, including focusing on prevention, intervention, education, research, advocacy, and public policy. And we provide leadership, we provide resources, really to a network of advocates, crisis professionals, volunteers, and community partners that make up California's safety net for survivors of sexual violence. And together, we are dedicated to promoting the best interests of survivors and advocate for systems and policies that actually end sexual violence. And if you are not already joining us on social media, we invite you to find us on Facebook, Twitter, and Instagram and follow us there. And then just a quick note, this topic today is heavy. And a lot of us are working in this daily, but that doesn't mean that we shouldn't acknowledge the weight of this topic. And so while we are together today, we'd love for you to be present, but that means not just with us, but also with yourself. And so if you need to take breaks, we, highly encourage that and support that. This content could impact you and might trigger feelings that really range. And so please take care of yourself. Step away if you need to, turn down the sound, reach out for support. We just really want to encourage that we all take care of ourselves and one another. And so we have some learning objectives. Today, we're going to be just kind of setting some foundations, thinking about the prevalence of sexual violence and abuse among people with disabilities, thinking about the barriers and solutions to services for survivors, specifically with intellectual and developmental disabilities. And I'll probably start using a little bit of shorthand to say IDD from here on out. So if you hear me say that, I'm referring to intellectual and developmental disabilities. We'll be defining trauma and trauma-informed support strategies, and then really thinking about what could partnerships between disability service providers and anti-sexual assault advocates look like. Priscilla, I think at this point, I am going to pass it over to you. I am happy you can cue me and I will try to play that clip. You just let me know when you're ready.
Okay, thank you, Ashley. This is Priscilla speaking. In this section today, we're going to discuss sexual violence in the IDD community. Persons with disabilities are one of the largest minority groups in the United States. Estimates of the population of Americans with disabilities are currently between 37.3 to 56.7 million, which is 12.1 to 18.7% of non-institutionalized people in the United States, depending on the way that disability is measured or defined. There's estimated to be about 8 million people with an intellectual or developmental disability in the US, which equals about 3% of our population. Rape crisis centers in California provide services to a diverse community of sexual violence survivors, which includes persons with disabilities. From the prevention perspective, people with developmental disabilities have many more risk factors. Mostly they're due to social and environmental factors. Sometimes folks can be isolated. They're often taught to be very compliant. They're not given critical information. They're overprotected, marginalized, segregated, and sometimes denied even basic human rights. So all of these factors contribute to alarming rates of sexual violence in this community. In 2018, National Public Radio, or NPR, released a special series titled Abused and Betrayed, which was based on an investigation that they launched about sexual abuse against folks with intellectual disabilities. We're going to play you a short clip about 4 minutes long. We're going to try to. This is the part that we've been having technical difficulties with, but we're going to try to play it. In this clip, survivors with intellectual disabilities are talking about their feelings after being assaulted. If you're not in the space to hear this content, please feel free to disengage. Again, it's about 4 minutes long. Ashley, if you could go ahead and play.
All right, I'm going to do my best. Let me know if you can't hear it.
With an intellectual disability, by definition, has difficulty learning or reasoning or problem solving. But one thing I've learned from my reporting, they often think deeply about the things that affect them, the things that isolate them, like sexual assault.
I felt dirty. I just felt not clean. I blamed myself, and I felt powerless.
Debbie Robinson was in her early 20s when she was raped.
I couldn't even look in the mirror because you see, all that comes back to you. It just does.
When the abuse happened, she couldn't even identify it as rape. She didn't get sex ed in school. The older man who abused her was related to someone who lived in her house. She'd been taught to trust him. She knew she didn't like it, that it was hidden, but she was confused. She thought maybe it was a relationship, a bad one.
I had to figure out that it's not my fault.
Sorry.
Somebody with an intellectual disability, by definition, has difficulty learning or reasoning or problem solving. It's hidden. But when she finally did tell her mother, she then had to deal with her mother's own feelings of failure and guilt.
That's why people would get angry, is because we didn't tell our own family members. But here I'm telling a stranger, which is a therapist. You know, that gets our families angry.
There's a wide range of intellectual disability. Some people have significant disabilities, mental and physical. Maybe they can't speak or they need assistance from family or staff for basic things like eating to personal things like being bathed. The vast majority, though, have mild intellectual disability. There's a new generation that grows up and gets better chances at school. Some now even go to college programs. But pretty much everyone with intellectual disabilities has one thing in common. They depend upon other people for assistance, and that puts them at risk.
We are taught to trust grown-ups more than anyone else will be, because when you have a disability, people are always telling you, do as that person says, do as this person.
That's Thomas Mangrum. He says he was a young boy when he was assaulted by a deacon at his church. He told his parents, but they never said anything about it to him again. Mangrum says people with intellectual disabilities just aren't believed.
They think that you got a disability, that means you lie. That you can't really tell the truth or you don't know what the truth is.
People with intellectual disabilities often do have trouble speaking or describing things in detail or in proper time sequence. Our investigation found that makes it harder for police to investigate and for prosecutors to win these cases in court. But when sexual assaults go unpunished, then perpetrators are free to abuse someone again. It's one reason the NPR numbers show the rate of assault for this population is so high. Thomas Mangrum, who lives in Washington, D.C., thinks it's a matter of bias.
And a lot of us in the disability community, people don't really see us. People don't see us at all. They just see our disability, and that's it.
Okay, that was it, Priscilla.
Thank you, Ashley. We've also pulled a few quotes from the survivors that participated in this NPR series. So this first quote is by Sam Maxwell of Meadville, Pennsylvania. Yes, it happened to me. It was a staff person. It started out where he was buying pop for me and candy for me. It was called the canteen. Then one time he asked me to come down in the basement. He wanted to show me something, and I trusted him. That's where it happened. Thelma Green in Washington, D.C. People look at people with disability as a lot of the time, they look at us thinking we don't know no better, because a lot of us is quiet and easygoing. They think that we weakling. We not. Cindy Whitaker in Austin, Texas. Some with disabilities are afraid to report it because they're afraid it will make them look bad, worse than they already are, because people already look down on you because you're disabled. It felt like the world was against me. We're going to be doing a breakout session now, where we're split into a few groups to discuss what we heard from these firsthand accounts and how they relate to the work that each of you do. We'll be asking you to report back with some of your answers in the chat. So in the chat, the questions that we're going to be asking are, what barriers exist for survivors with IDD when reaching out for support from community members and service providers? How does sexual violence affect the communities you work with? What kind of support do you need to support survivors with IDD? So I'm going to break everyone into breakout rooms now. So this is Priscilla speaking again. Does anyone want to share some things that they discussed, maybe pop into the chat, or what support that you discussed that you would need in order to better support folks in the IDD community?
Priscilla, this is Ashley. So while folks are maybe sharing in the chat, I was sent to a room. I did not announce myself because there was a great conversation happening. So I just was listening, learning. But I just appreciate the folks that were in the room that I was in there was some like resource sharing happening, and it was a really rich conversation.
Awesome. Yeah, we realized that you probably can't maneuver that with a telephone, right? That you just end up wherever we send you. So I'm glad that you got to witness a conversation though. So it looks like in the chat, folks are talking about using the correct language and consent. So yeah, consent is a huge issue in the IDD community, especially, in every state, there's different laws about mandated reporting. And so it's an issue that we all need to kind of figure out a way around, and, helping folks be able to make their own choices while still respecting the law. Audrey's saying that they live in a rural area, so they don't have a lot of IDD services available. And if there are services that are not necessarily known or easily available, and then not wanting to communicate through another person, caregiver, to the client who has an IDD, right? Yeah, that's a big thing, making sure that we're speaking directly to individuals and not going through their support person to kind of interpret or translate or, tell us what they think that person wants. Meredith is sharing that there's a peer-to-peer plain language resource by a self-advocacy group in Vermont, making information accessible and not having to talk to a caregiver, and they dropped that resource in the chat. So thank you so much, Meredith, for sharing that resource with the other group that wasn't partial to your, that wasn't privy to your conversation. That's great. So as folks continue to share more in the chat, we're going to go over some statistics related to folks with disabilities. The majority of these statistics that we're going to discuss came from the same project that NPR did. But in order to find these numbers, NPR had to request for the Bureau of Justice Statistics to separate out the figures for people with IDD, because these statistics had not previously been studied. These numbers do not include those who live in institutions who may be at even higher risk for abuse. NPR partnered with the National Disability Service Provider, the ARC, to interview the survivors that we previously heard from, and also to create the charts that we're going to share. According to the Bureau of Justice Statistics in 2014, the rate of rape and sexual assault against people with intellectual disabilities was more than 7 times the rate against people without disabilities. Among women with intellectual disabilities, it's about 12 times the rate. The violent victimization rate against persons with disabilities was more than twice the rate for persons without disabilities. The ARC shares that 50% of all violence against persons with disabilities occurs against victims with multiple disabilities. The Bureau of Justice Statistics also shares that a person with cognitive disabilities has the highest rates of total violent crime, serious violent crime, and simple assault among the disability types measured. Those with hearing disabilities had the lowest rate of total violent victimizations during their data collection years of 2010 to 2014. We know that about 70% of all abuse cases against adults with disabilities go unreported. Additional research from the Bureau of Justice Statistics shares that total violence against persons with ambulatory disabilities, 51%, was more likely to be reported to police than violence against persons with vision, 39%, or self-care, 44% disabilities. These staggering statistics point out the extremely low reporting and disclosure rates for survivors with disabilities, or we would be serving far more survivors with disabilities in our centers. Most of the time, survivors know their offenders. 66% of offenders are an acquaintance, intimate partner, or other relative. Acquaintances in this instance can be caretakers, program staff, group home employees, coworkers, supervisors, friends, in addition to the other acquaintances that we might typically think of. When we consider all of the numbers that we've already discussed, it makes sense that violence would also be reoccurring. 80% of survivors with IDD have been sexually assaulted or abused more than once. 49% of people with IDD will experience 10 or more incidents of sexual violence. And now Ashley is going to talk to us a little bit about risk and protective factors.
Yeah, so this is Ashley, and I know, so first of all, I just want to say, I know this slide is not easy to read and that it has a lot of information on it. If one of my Valor colleagues could pop the link to where folks can download it, I'd appreciate that. That way you can view it at a more optimal level for yourself. But I want to just highlight a couple of things that this infographic tells us. So Priscilla just shared a bunch of statistics to help us understand the scope of the problem when it comes to sexual assault and people with IDD. And I think it's really important to note that it isn't someone's identity or disability that creates a higher risk for sexual assault, but it's really the way that society, systems, institutions, etc., and actually I want to say, and social norms operate, right? Like the way that society is structured and systems operate, these are the things that really create a higher risk for certain people. And this infographic, I think, helps illustrate that. So, for example, things like poverty, lack of employment opportunities, tolerance of sexual violence, and lack of accountability for folks who perpetrate sexual violence, those are all things that increase the likelihood that sexual violence will occur. And those are all things that people with developmental disabilities and intellectual disabilities are experiencing at higher rates. And then I think additionally, things like ableism, equitable access to educational, economic, and job opportunities, opportunities for community engagement, social support, physical barriers, and all sorts of other kind of aspects of how we live, work, play. All of those things can determine how likely it is that people will have what they need to reach their optimal health. So if we think about, when ableism is such kind of like a core in our society, that's really going to determine how people can reach their optimal health. And so I just wanted to highlight this because I think it helps kind of explain the landscape of why folks with IDD do experience sexual violence at a higher risk. And Priscilla, if you go to the next slide, these are some other kind of barriers to accessing services. A couple things that I want to say about these considerations include, a lot of times folks with IDD rely on transportation that can be really unreliable. Many ride services, there's more of like a time window than an actual specific time that someone may arrive. And even with that time window, sometimes they don't adhere to that. And so folks can be waiting for long periods of time. That could be, not the safest thing, but it also can be a real barrier to accessing services. If you are trying to get to a counseling session, but you can't even necessarily know when your ride is going to arrive, how do you keep those appointments? We also know there's lots of communication barriers. And in the breakout room I was in, this was a topic that came up was, what kind of materials are we creating for survivors of sexual violence? Does the language, will it resonate with people with IDD? Is it understandable? So we have to think about how people receive information We also know that people with disabilities sometimes use nonverbal forms of communication. And so that can really cause alienation when folks don't understand how to use those forms of communication or aren't even aware that they exist. We also know, and this was another thing that came up in the group that I was kind of eavesdropping in, and that's educational and socialization factors. A lot of times folks with disabilities aren't given any information about sexual health or healthy relationships. There's just this kind of stereotype that they're asexual and they're not given the space or support to really explore their sexuality. And so, you know, this can really create an environment where sexuality is seen as something that is not talked about, it's not discussed, and that can make it easier for someone to coerce an individual into a secret relationship that could be abusive. It's really dangerous when we are not supporting folks in exploring their sexuality and healthy relationships. And then there's lots of stereotypes about people with disabilities, like I pointed to a moment ago. So they're asexual or that they're hypersexual. There's stereotypes that we don't need to teach folks. They don't need to know about sex. Stereotypes that they're childlike, that they're not able to understand consent. There's stereotypes that, you know, despite what Priscilla just walked us through, these really high numbers, there's an idea in society that folks with IDD don't get sexually assaulted or abused. That's not something that happens to them. And so we know that people with disabilities have a full range of expression, including emotional expression, gender expression, sexual expression, intellectual expression, and they have the same inherent sexual rights as any other adult. But these really create barriers, not just for folks to be able to live like their best, most authentic lives, but also in terms of accessing support services. Will you go to the next slide, Priscilla? You know, there's also a lot of devaluation when it comes to folks with IDD. They're often not treated as valued members of society. They can be employed at really low rates, and the jobs that they are given can be like incredibly low paying to the point where they're doing piecework, which could amount to like a few dollars a day. So that you know, brings me back to my previous point about poverty as being a risk factor. Like, this is something that we are setting up. We also know that folks with IDD are sometimes assumed to kind of not know the truth or understand the truth. And I think you heard that in an NPR clip that we played. One of the most important things that we can do for any survivor is to believe them and to take all disclosure seriously. And so that's a really, really big one. You know, we also think about this idea of isolation and segregation that Priscilla mentioned. Folks with disabilities are often kind of like, for lack of a better, you know, way to describe it, hidden away, right? They're in programs or in homes where they're really segregated from the rest of the community. And as I pointed to a few minutes ago, a lack of social support and social connection can put people at risk of sexual violence. And so, you know, just a couple more points that I want to make on this slide is when folks are treated like children, you know, what do we also teach children to do? We teach children to obey adults, right? To listen, to do what people say. And so when folks with disabilities don't do that, they can be labeled as non-compliant or having behaviors if they don't go along with what a service provider or a caregiver requests. And so again, that starts to create a social norm that can be really risky. And I think I'll stop there. But those are just some of the things that we wanted to kind of bring to the surface that kind of create these environments where folks with IDD are at a higher risk of sexual violence. And Priscilla, I think we are moving to another audience poll that I'll pass back to you.
Thank you. This is Priscilla speaking. For our next poll, we've broken it down into 2 sections. This first question is for folks who work at a disability-based company or organization, something like a day program, group home, regional center. We want to know if your intake process includes questions about previous or ongoing sexual abuse or harassment. So if there's anyone here from a disability organization, I think we only had 1 person when I first looked. So it looks like the 1 person responding says that yes, their intake process does include questions about sexual abuse or harassment. Okay. And then our next poll,
Sorry, Priscilla, this is Shelby. I just wanted, there's someone responded in the chat also to the last poll that they don't have an intake process because they're not a direct service provider, and that's Meredith. So I just wanted to lift that up.
Thank you. Okay, for our rape crisis centers, that's going to be our next poll. Does your intake process include questions about accessibility or accommodations? So far, we have 1 responder. It looks like they said yes. 1 yes, 1 no. So 2 yes, 1 no. 3 yes, 1 no. So it looks like it's becoming a little bit more common now to have accessibility questions, which is great. Okay. So for folks that are in the world of disability support, you may be aware of the ways in which a specific disability may affect someone. But for many folks, trauma and the effects that it can have is something that has not been taught to us in this world. What is trauma? Trauma is the response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of helplessness, diminishes their sense of self, and their ability to feel the full range of emotions and experiences. So some of the things that we may see with trauma is insomnia, nightmares or flashbacks, panic attacks, maybe substance abuse or eating disorders, people feeling depressed or irritable. It's important to note that while these responses are typical, they do not include all of the ways in which each individual person may respond to a traumatic situation. If someone does not experience these signs or symptoms, it doesn't mean that they're lying about their trauma or that they haven't been affected by it. Trauma-informed care is care and practices that recognize and respond to the impact of trauma on individuals, families, communities, and society at large. Care and practice that actively resist re-traumatization. The 4 R's of trauma-informed care and response. Trauma-informed care realizes the widespread impact of trauma and understands potential paths for recovery. It recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system. Responds by fully integrating knowledge about trauma into policies, procedures, and practices. Resists re-traumatization. So survivor-centered approach. Before we discuss this slide, I want to acknowledge that these are all suggestions about what can be done to the best of your ability while in accordance with state law. As I mentioned earlier, some of you may be mandated reporters or may work alongside folks that have a conservator involved. Experiencing sexual assault often leaves people feeling like they don't have control over what happens to them and their bodies. And folks with disabilities often experience a lack of control on a daily basis. These approaches are not meant to supersede any law, but instead to show what is most helpful for supporting individuals while they take back their power and control. Much like person-centered care or planning, a survivor-centered approach prioritizes the individual that you're supporting. Individuals have the right to be treated with dignity and respect instead of being exposed to victim-blaming attitudes. They have the right to choose the course of action in dealing with the violence instead of feeling powerless. They have the right to privacy and confidentiality instead of exposure. They have the right to non-discrimination instead of discrimination based on gender, age, race, ethnicity, ability, sexual orientation, or HIV status, or any other characteristic. They have the right to receive comprehensive information to help them make their own decision instead of being told what to do. So moving on from disability responsive to trauma responsive. Disability workers are trained to be disability responsive. This means that you provide supports and services that are adapted to the needs of people with disabilities. You work to help remove barriers that may exclude folks with disabilities and ensure they're able to fully participate in ways that are important to them. While disability agency workers may be experienced with this type of responsiveness, they may not be aware of trauma responsive care and may need additional training to support individuals that experience trauma. The following actions are trauma responsive. Recognizing the high prevalence of sexual violence amongst people with IDD. Assess and remove barriers that prevent survivors with IDD from disclosing. Train staff to believe survivors with IDD and respond compassionately. Train staff to incorporate healthy sexuality and healing into existing service plans. Excuse me. Collaborate with rape crisis centers on protocols to provide prompt victim-centered services. Ashley, if you want to go ahead and launch this poll, if you're.
Sure.
Are you following?
This is Ashley. Yeah. So I know that it sounds like the majority of our audience are actually from a rape crisis center. But we want to launch this poll anyways. And for those of you who are not from an RCC or a dual agency, we just would love to know if you are aware of your local rape crisis center. So hopefully you see that poll. I don't know if anyone has responded.
So far, it says that everyone's aware of their local rape crisis center.
Okay, well, that's great. That's good news. So if you want to move on, so we just wanted to share briefly about the community blueprint because, I mentioned earlier that we'll be releasing our community blueprint in the early fall. And it's really going to include a roadmap to being able to create sustainable partnerships between sexual assault agencies and other sectors and just the broader community. And I think this comes from the fact that we know that sexual violence isn't a single issue, right? It doesn't just exist on an island separate from all the other issues that are impacting someone's life, including other social justice issues. And I think if you've been with a rape crisis program or a sexual assault program for a while, you've probably partnered with people in the community, but traditionally those partnerships have been kind of limited to law enforcement and healthcare providers. And this blueprint really comes out of the belief and the recognition that in order to address the root causes of sexual violence, we really need to be looking at oppression. We really need to be approaching this work through a community-driven perspective. And that requires us to work with other social service and social justice organizations. And so the community blueprint is going to kind of walk everyone through a series of considerations and questions to be able to strengthen partnerships within the broader community. It's not going to be a prescription for how to do the work. You are all experts in your local communities, and what works in one setting will not work in another one necessarily. So it's not prescriptive, but it's really just a set of considerations. And as I said, it'll be available in the fall. We, would love to kind of follow up after it's released and hear how it's been helpful. But we hope that it will be helpful. There are some really great examples nationally of sexual assault programs coming together with disability service providers to make changes to the way that folks with disabilities are viewed and treated and what is available to them in terms of services. And so I have an example on the slide that I think you're looking at, and it's from Indiana, where anti-sexual violence organizations worked really closely with people with disabilities and disability service providers to make accessing the community easier and safer. And so they focused on repairing sidewalks and making transportation more accessible so that folks with IDD were able to go out into the community and make those social connections and really feel like they were part of a larger community, which we know can help prevent sexual assault. So that's just an example of one. That's not to say that that's what you all should do, but it's an example of something that has been sustainable and has worked really well. And hopefully one of my Valor colleagues can put the link to where you can read more about that work, because it's super, super inspiring. So we'd love to know now, I believe, a question for you. And that is really, what type of partnerships are you currently engaged in, specifically around supporting people with intellectual and developmental disabilities? And so if you are a rape crisis center or a dual agency or on a campus, do you have any relationships with groups or service providers that center folks with IDD? If you are a disability service provider, do you partner with any community services to integrate folks with IDD into the community? We would love to know, kind of the baseline where folks are at today. Priscilla, if you would just maybe give me a summary of anything that might be coming up in the chat, I'd love that. So feel free to jump in if things come up. Moving on, so, as I said at the beginning, we kind of developed this content for disability service providers in mind. So I know a lot of you are from rape crisis centers, but we did just want to do a brief kind of rundown of some of the services that are often available at rape crisis centers for folks who are working in disability services to know and have that awareness. And so traditionally, rape crisis centers offer things like crisis response. This could be either in person or over the phone. Most rape crisis centers have a 24-hour hotline available. Right now, especially because of the pandemic, a lot of rape crisis centers are offering virtual counseling sessions. Rape crisis centers will also provide accompaniment services, and that could be during a rape exam, but it could also include legal appointments. It could include speaking with law enforcement, and really that advocate is just there to support the survivor and really provide support, referrals, resources. Rape crisis centers also offer counseling, and that can look different. There's individual counseling, there's group counseling. Some rape crisis centers have support groups for family members. So it really just depends on the individual rape crisis center, but there's definitely counseling available. The advocacy, again, it's a lot about giving resources, referrals, information, options, letting folks know what their options are. And then many rape crisis centers are also doing a lot of education in the community. So letting folks know what the services are, but then also working to prevent sexual violence. And so those are just some of the services available. If there's any RCCs on here that have any additional services and you'd like to share that, we'd love to know that. But I wanted to share next, so if you'd go to the next slide, some examples of what partnerships might look like between disability providers and rape crisis centers. I already mentioned that folks with IDD are often not treated as valued members of society. And it's so important, I think, when we are working to provide healing and advocacy and support services to recognize where folks are being left out, and then to take steps to be able to create partnerships where we're not leaving anyone out, that we are a place where people in the community can find healing. And so sometimes those partnerships can look, pretty simple. We can provide referrals. We can provide resources. So, one of the recommendations that Priscilla talked about earlier for disability service providers was including information about healthy sexuality and healthy relationships for folks with IDD. That's something that a rape crisis center, I think, is poised to help with, to help create some of that. We do that so often anyways in our community education. And so working and partnering with a disability service provider or with self-advocates, folks from the IDD community, to create resources specific to them, I think could be a really great partnership. I've also seen, rape crisis centers do specific community education and training with disability service providers and receive cross-training from them. So folks that work at a rape crisis center are likely not experts on folks with IDD, but could, receive experience and knowledge and expertise from disability service providers. So those are just a couple of examples. I think I'm going to go ahead and skip the next audience poll and go to our slide about learning about your local rape crisis center. So if you're not from a rape crisis center and you don't know what your local rape crisis center is, we do have a tool on our website that allows you to search, and I believe it's nationwide, so not just specific to California, but you can enter in information and it'll bring up your local rape crisis center. And if someone would give that link, I would really appreciate that. So if you would go to the next slide about moving forward, relationships and trust in order to partner with organizations takes a lot of time to build. I don't know about you all, but I have a background working in rape crisis centers, and a lot of times we would be approached by other agencies or organizations to partner together, and I was always open to that. But the best partnerships ended up because we took time to build a relationship and to really respect the work that each organization was doing. And so I think that's kind of like the key, is that relationship building. If you go to the next slide, I think when we talk about partnerships, there are kind of different levels of partnerships. Some of them are a little bit more like surface level, which I think this chart points to in the cooperation field. And so, maybe you're just sharing information, you're sharing resources, you're putting a flyer up at a disability service provider organization, or the disability service providers are sharing the hotline number to the Rape Crisis Center. You have a cooperation there. You're sharing resources, you're sharing information. If we move a little bit into the next level of partnership, that could look a little bit more like there's a commitment to advancing each other's work, right? There's more of a formalized relationship. There's more of a commitment to really, thinking about a shared project or program. So maybe a rape crisis center wants to create a support group just for folks with IDD. And so that might be a partnership with disability service provider, or vice versa. Maybe disability service providers want to create a support group for folks with IDD who are survivors of sexual violence. That may require some coordination between both programs. But I think like the ultimate partnership is really thinking about collaboration. And so that is really thinking about, like, beyond our organizations, how do we make changes to impact people on a more like systems level? How do we change social norms? How do we think about the way that our systems operate so that we're not putting folks at a higher risk, or we're not creating barriers for access? So I am going to pass it back to you to talk a little bit more about moving forward in partnerships.
So learning from the past and learning from each other. We recognize that there are challenges in doing collaborative work. They can arise from historical issues of collaboration in your community. So there can be some questions to ask yourself and discuss with your community partners when you begin your journey together. What's the history of collaboration in your organization? You may want to bring in someone who has a long history with the community who may hold this knowledge. What patterns of events or barriers have led to abuses of the rights of our community members? Have your community members had negative experiences with law enforcement or medical providers in your city? Is it necessary to conduct an assessment within a certain system or institution to address patterns of abuse? How has inequality played a part in service provision and community education? Are some of your agency's resources more accessible to certain community members over others? Does one agency receive more funding than the other? Can you apply for funding together to increase funding opportunities? And ways has the past affected the ability to work together? Is it necessary to start working through conflict before collaborating on a project with each other?
Thanks, Priscilla. This is Ashley again. I think that learning from the past and learning from each other is really important. Working in local rape crisis centers for many years, I definitely found myself in a position once or twice where I thought it was important to partner with a specific organization, and found out that there had in fact been a partnership years past and it hadn't gone well. And I wasn't necessarily like privy to that information. And so, that's really awkward if the organization you're trying to partner with is like, oh yeah, we did work with you all and you did X, Y, or Z. But I think like that shouldn't stop us from moving forward, right? Like, how do we kind of acknowledge the history between our organizations and then move forward? Because again, we know that our outcome is about making our communities places where people can thrive and where people can live free from sexual violence. And I don't know if you've gone to my terrible slide again yet, but if you haven't, if you would, here's that slide again. this time I wanted to show it because I want to highlight some of the opportunities that can protect people from experiencing sexual assault that both disability service providers and rape crisis centers really have a role to impact change in. So things like community support and connectedness, things like coordinating services and resources across community agencies and providing access to mental health support. These are all things that rape crisis centers and disability service providers can partner together to increase. To me, again, this infographic shows some like real strong connections of ways that disability service providers and rape crisis centers can work together to increase things that you all are probably already doing. And, you know, just some tips, some ingredients of a successful collaboration. I think, again, that mutual respect and kind of mutual respect and understanding of where our partners are coming from on these different issues, I think is really important, right? Understanding like what is the person that you are wanting to collaborate? What is their organization's mission? What is their approach? And how does it align with ours? Or maybe how doesn't it align with ours? Like these are all really important things to know. What are the things that each of us are bringing to the table that we can really draw on? So thinking about like our strengths and our assets. And I think like at the end of the day, it really comes down to how committed are we to supporting survivors with intellectual and developmental disabilities, right? Like we really need each other. We're stronger together. And so how committed are we to providing that accessibility? I think goes really far when we're trying to find solutions for survivors with IDD to receive services and to not experience sexual violence. And Priscilla, if you go to the next slide, you know, some things that we can kind of do, because I also realize that sometimes we go to like a web conference or a workshop or a training and there's ideas and we get excited and inspired, but maybe we don't have the organizational power to like make those changes. I totally understand that. I've been in that position so many times. There are things that we can do, you know, individually that can also make an impact. And so thinking about the stereotypes that you might hold, whether it's stereotypes about folks with intellectual and developmental disabilities or stereotypes about sexual assault survivors. You know, I think we all have those. And so really examining those, understanding where they come from, and then really seeking out the truth. I think also thinking about how comfortable are we supporting people with intellectual and developmental disabilities? How comfortable are we talking about sexual violence? To be able to really collaborate and partner together, we have to understand where that comfort lies and how we move forward and move past some of that discomfort. You know, again, thinking about like the barriers, the limitations, the lack of resources that we may have, either in supporting survivors or supporting folks with intellectual and developmental disabilities. We have to think about that, right? I think that sometimes we can inadvertently cause more harm if we are not being really aware and intentional about what our limitations might be. And then thinking through, you know, what are some of the places where you can seek out more information? There are so many great resources online and through community partners that can really help us increase our ability to provide services. And Priscilla, I want to pass it to you because Valor, we actually have a really exciting project that we're working on. And for the Rape Crisis Center, specifically on this call, you will likely be hearing from us in the coming months or so. So Priscilla, I'll let you share a little bit about what we're doing.
Thanks, Ashley. This is Priscilla. Valor US is partnering with the ARC of California, also known as the ARC, a statewide organization. They also have national capacity, but we're partnering with the California organization that supports folks with intellectual and developmental disabilities in order to increase and build capacity of rape crisis centers and disability service providers, so that we can both better serve people with IDD who are survivors of sexual assault. This project is going to foster closer working relationships between the strong existing networks across California, and participation is essential for sustainable systemic change. Valor US and the ARC will help their member organizations assess their needs, develop a plan to build network capacity, and they'll provide more effective and accessible services to survivors with IDD. If you're joining us today from a California Rape Crisis Center and you think that your organization would like to be involved in this project, please feel free to reach out to Ashley or I after the presentation. These are our email addresses. Or if you just like a little bit more information about what the project is and what we're working on, please feel free to reach out. We now have a chat question. If you could just answer in the chat, what's one new thing that you learned from today's workshop? So just to kind of share, to wrap things up, so you could share with us, what's something that you're going to take away from today, something you learned, something that you felt was helpful. And then we have a list of resources for you as well as a survey. So I'm going to go ahead and drop these in the chat while you all are gathering your thoughts and sharing what you felt was helpful. Meredith is saying that she really liked learning from the past and learning from each other slide.
Yeah, Meredith, I think that's so important because, I don't know, from my perspective, sometimes those past relationships kind of are like roadblocks, and that's really unfortunate. I definitely understand past feelings and just, it can be really hard to partner, especially in a landscape where resources are not infinite. But I think there is so much potential if we can work through those and move forward. And again, just always keeping in mind what we're here for, what the purpose is, can help us do that. So I'm glad to hear that.
And I dropped the survey and some of the resources in the chat. If anyone has any questions, you can feel free to type it in the chat or go ahead and unmute yourselves and ask. We'll be here for a couple more minutes. But if you don't have any questions, then thank you so much for joining us today. We really appreciate your participation. Audrey's saying how to create a collaboration, which will really help with the development of materials, referrals, and etc., and how helpful that can be as a sexual assault domestic violence agency that can learn a lot from an IDD agency or organization. Yeah, that's great, Audrey. That's really what, we're trying to focus on as well, is, making those community connections and ensuring that multiple agencies are able to serve all different types of people with whatever going on in their lives right now.
I also wanted to just thank our ASL and Spanish interpreters and all of our Valor staff for the support, especially carrying me through my lack of internet. I appreciate you all. Thank you so much, Priscilla. And again, thank you all so much for joining us. Again, we'll be doing a series in the fall specifically for rape crisis centers working with partnerships. So we hope to see you there as well. Thanks, everyone.